My first false positive was March of 1984. No matter how old you are, the choices you make will determine what happens in the future. I think the biggest thing out of all of it is knowing that no matter what it is, that you can live with it, depending again on your choices you make and the path you choose. The medicines today, it's not 32 pills a day. I knew people that were taking 16 pills 2-3 times a day. So you spend your whole day just taking pills. And now it's 1 pill a day for most people, if they're lucky, if they're not already immune to what's available because of their choices.
Tens of thousands of HIV-positive people are leading normal lives thanks to life-saving drugs that are available and free for those people who cannot afford them. I'm HIV positive, and I take my medicine at the same time every day. It took a little getting used to, but I was determined. Now it's routine, almost like brushing my teeth. In this section, we're going to cover how HIV medicine works in the body, why it's important to take your medication on time every day, and what can happen if you don't.
Your blood has many tiny cells, and they have different jobs. Some cells build things your body needs. Other cells, like CD4 T cells, work to defend your body and defeat invaders. These cells are part of your immune system. Immune system cells may fight invaders, such as viruses, or they may send out the alarm that a virus is invading. When other defender cells get the alarm, they multiply and fight the invaders. What's unusual about the HIV virus is how it invades the defender CD4 T cells, uses them to make lots of HIV copies, and then destroys the defender CD4 T cells. That's why HIV is called the human immunodeficiency virus. It's a virus that destroys the human immune system, our body's system that defends us against infections. The good news? There is HIV medicine that slows the HIV invasion. You and your provider decide when it's time for you to start taking HIV medicine. How does the medicine work? In several ways. When HIV tries to break into the CD4 T cell using a chemical key, some HIV medicines change the lock so HIV can't get in. Other HIV medicines disrupt the HIV copying process. And still other medicines stop HIV from becoming a new virus that can break out of the CD4 T cell and travel in the blood. Combination HIV medicines use 2 or all 3 of these ways to slow HIV. Combination medicines work the best. They are called HAART, which stands for Highly Active Antiretroviral Therapy. For HAART to be effective, you need to keep the right amount of medicine in your blood. You must take your prescribed HIV medicine every day on time. When HAART medicine is taken as directed, your HIV viral load can drop so low that lab tests can't detect any HIV in your body. The virus is undetectable. When HIV is undetectable, your CD4 T defender cells can recover. But remember that HIV medicine can't reach all of the HIV. Once you are infected, HIV is with you for life, waiting for the chance to multiply. Why is it so important to take HIV medicine on time every day, not early, not late? And why is it important to take exactly as much as prescribed, no more, no less? Let's use an example. If you take HIV medicine once a day in the morning, after you take the medicine, it's absorbed into your system. More and more medicine goes into the bloodstream until it reaches a high point or peak, halfway to your next dose. After the peak, it gradually drops. Then the next morning, it's time to take your medicine again. This happens each day when you take your medicine on time. There's just enough medicine in your blood to control the HIV. Taking HIV medicine early or doubling up on doses has no health benefit, and you risk more side effects. Skipping doses or taking them late gives HIV a chance to get stronger. Your HIV medicine may stop being effective. Your provider may need to find a new medicine. The new medicine may have more side effects, and you may run out of medicines that work. To ensure your HIV medicine works, call your provider about any side effects. Take medicine with food if that's what it says on the label, and plan ahead so you always have HIV medicine on hand.
Remember, HIV hides and changes. It's never all gone. To stay healthy, work with your provider. You and your medical provider will find the right heart treatment for you and decide when to start. Then, take your HIV medication on time every day and get on with the business of living.